Hello and welcome. Today we're diving into a common yet often misunderstood condition, Detrusor overactivity, or OAB. We'll explore what it is, what causes it, and how it's managed, so you can better understand this condition. So, what triggers this overactivity? The exact cause of Detrusor overactivity is often unknown, making it idiopathic. However, several factors can contribute. Neurological conditions like stroke, Parkinson's disease, multiple sclerosis, and spinal cord injuries can disrupt the communication between the brain and bladder. Obstructions like an enlarged prostate in men or bladder stones can irritate the bladder. Certain medications, such as diuretics, can increase urine production. And in some cases, simple age-related changes in the bladder itself can be a factor. Even habits like excessive caffeine or alcohol consumption can play a role. Let's break down the pathophysiology. Normally, your bladder fills with urine, and stretch receptors signal your brain that it's getting full. Your brain then tells the detrusor muscle, the bladder wall muscle, to remain relaxed until you consciously decide to urinate. In detrusor overactivity, the detrusor muscle contracts involuntarily, even when the bladder isn't full. These spontaneous contractions create a sudden urge to urinate, leading to the symptoms of OAB. It's like the bladder is acting on its own, bypassing the brain's control. Detrusor overactivity is quite prevalent, affecting millions of people worldwide. While it can occur at any age, it's more common as we get older. Studies suggest that over 30% of men and 40% of women experience OAB symptoms at some point in their lives. However, many people are hesitant to seek help, which leads to underdiagnosis and undertreatment. The prevalence is likely even higher than reported, highlighting the need for greater awareness and open communication with healthcare providers. The hallmark symptoms of detrusor overactivity are urgency, frequency, and nocturia. Urgency is that sudden, compelling need to urinate that's difficult to defer. Frequency is needing to urinate more often than usual, typically defined as more than 8 times in a 24-hour period. Nocturia is waking up 1 or more times during the night to urinate. And in some cases, OAB can also lead to urge incontinence, which is the involuntary loss of urine associated with a strong urge to urinate. Diagnosing detrusor overactivity typically involves a thorough medical history, physical examination, and some simple tests. Your doctor will ask about your symptoms, medications, and any underlying medical conditions. A bladder diary, where you track your fluid intake and urination habits, can provide valuable information. A urine test can rule out infection or other conditions. In some cases, urodynamic testing, which measures bladder function, may be recommended to confirm the diagnosis and assess the severity of the condition. While there aren't strict types of detrusor overactivity, it's often categorized by the presence or absence of urge incontinence. We have dry OAB, where people experience urgency and frequency but do not leak urine, and OA, where urgency is accompanied by urge incontinence. Fortunately, several treatment options are available to manage detrusor overactivity. Lifestyle modifications are often the first line of defense. This includes bladder training, which involves gradually increasing the intervals between urination, pelvic floor exercises, also known as Kegels, to strengthen the muscles that support the bladder, and dietary changes, such as limiting caffeine and alcohol. Medications, such as muscarinics and beta-3 adrenergic agonists, can help relax the bladder muscle and reduce urgency. In more severe cases, advanced therapies like Botox injections into the bladder muscle or sacral nerve stimulation may be considered. Managing fluid intake and treating underlying conditions, such as prostate enlargement, are also important aspects of management. While we can't entirely prevent detrusor overactivity, certain lifestyle changes can help reduce your risk. Maintaining a healthy weight, avoiding excessive caffeine and alcohol, practicing pelvic floor exercises, and managing underlying medical conditions like diabetes can all contribute to better bladder health. Regular check-ups with your doctor are also important for early detection and management of any potential issues. The prognosis for detrusor overactivity is generally good. While it's often a chronic condition, it can be effectively managed with a combination of lifestyle modifications, medications, and other therapies. Recent research has focused on developing new and more targeted medications with fewer side effects. Studies are also exploring the role of genetics in OAB and the potential for personalized treatment approaches. And with ongoing advancements in technology, we can expect even more innovative and effective treatments to emerge in the future, ultimately improving the quality of life for those living with detrusor overactivity. Thank you for watching.